My name is Jeff Olsen. I'm a physical therapist by background, and I'm the therapy supervisor for the Acute Rehab Unit here at Ogden Regional. A concussion is a brain injury. It can be from a trauma or a non-traumatic event, but most commonly we hear about concussions related to sports. Interestingly, a couple weeks ago, I think Brett Favre was interviewed again, and he estimated he has probably had over 1,000 concussions in his career. Over the course of his quarterback career in the NFL, I think he said he was officially diagnosed with a concussion 3 or 4 times. But when he realized that it was more than just losing consciousness, it was seeing stars or getting your bell rung, he's like, well, that was almost every play. A lot of times they'll not realize it unless it's pretty obvious. Usually it takes the work of a good coach or parent or athletic trainer, somebody that recognizes that something's not quite right. If an athlete is knocked out, there's a good chance it's a concussion. But there's other less obvious signs. They're foggy. They can't remember what the play is. They have a headache for sure. Mild brain injuries or concussions can be cumulative. After you've had one concussion, you have an increased risk of possibly getting a second and a third, and that damage can progress over time. Long term, they don't know really well the risks, but there are some diseases that can develop, such as chronic traumatic encephalopathy, that's common with boxers or some NFL players. It's a lot similar to Alzheimer's, but attributable to different mechanisms in the brain that are injured by the concussions. And frankly, they can be very serious. There is many states have enacted a law stating that if a patient or if an athlete does appear to have a concussion, they should be pulled immediately from play until they're cleared by a medical professional. There is a risk of a second impact injury that can be deadly if an athlete sustains a second concussion back to back, pretty much. Education's a big part of it. I think the best way to help a brain injury is to prevent them in the first place. Helmets, safety gear are very important. With children and infants, half of the brain injuries that occur in children are usually the result of falls. So stair gates, soft surfaces under playgrounds, age-appropriate and size-appropriate car seats, and just preventative measures to keep children safe is important. With athletes, it's certainly pull them out if there's any chance they might have sustained an injury that looks like a concussion, and get them out of the game so that they can recover. Just like you wouldn't keep playing on a broken leg, which would be pretty obvious sometimes, you don't want to keep playing on a concussion, or you risk more serious injury. We help people with concussions and all sorts of brain injuries try to return to what they were doing before as best we can. We certainly will practice and work on things that will repair the damage and hopefully minimize any long-term effects. We try to help people to overcome the injury, and any residual impairments, we'll try to work with them on how to adapt and to live with them if they have to. But anyway, prevention's the first line of defense. And then if there are lingering symptoms from a concussion, certainly seek medical help. And we've got things we can do to work with to get athletes and people back doing what they love to do as soon as we can. Yes, we'll do our best to do it. Yeah, come see us.